as a son of a father who spent his final months in aged care, let me start by thanking all of our carers, our nurses, the cleaners and the cooks, the doctors, the pharmacists, the volunteers, the providers that have been taking care of our loved ones. They do a great job. They do a great job. But I also know from this report and from our work in these roles that there are great challenges. Two huge trends. The ageing society, which is part of the Western world, more older Australians, and at the same time, the legitimate expectation of better, stronger, deeper care. Those two things come together. Our society and our task on our watch. And that means that we have two fundamental duties. One is to help shape the national culture of respect for our elders. We have much to learn from some parts of the world. The concept of the elder, somebody who has given to that society and that community, but who deserves respect and care and dignity. And secondly, to help provide at the national level that fundamental care structure. And that's where we go from here. We know that there are 1.3 million people within the aged care system in Australia. Home support, home care, residential aged care. And this monumental report, 8 volumes, 148 recommendations, monumental in scope, 2 years in construction, over 10,000 submissions, 640 witnesses, sets out some fundamental choices. And yes, there are some alternative approaches that have been presented by the commissioners, but the central vision is of a nation where we value our elders, where we respect them, we provide care and we provide dignity, and we respond to their individual needs. That's the critical thing. We respond to their individual needs. So it includes, as the Prime Minister said, a 5-year plan, a 5-year roadmap. Ambitious, challenging, but achievable. And there are 5 pillars to the way in which we will respond to this in terms of home care, quality and safety, services and sustainability, workforce and governance. And I'll come to those in a moment. Just before doing that, in protecting our Australians, it's important to note that today there have been 0 cases of community transmission for COVID around the country. That's 31 days this year, and no lives lost in 2021, an almost unthinkable collective national achievement. And in terms of the rollout, we've now passed 10,070 seniors as of last night who were vaccinated in residential aged care facilities, our most frail, roughly the same number as New South Wales and almost 3 times greater than any other state. Facilities, over 130 facilities and another 20 to be done at least today, which will take us to well over 150 facilities, and nationally over 33,700 Australians who were vaccinated, but with the numbers to significantly step up during the course of this week. So then that brings me to our initial, as the Prime Minister said, response, with the full response to the 148 recommendations to come during the course of the budget process. Firstly, in terms of home care, we will immediately act on transparency of fees and commence an audit program of over 500 facilities per year and providers. That's a very important part of protecting our elders against any abuse. At the same time, we will be implementing a new quality control system within home care. Secondly, in terms of residential care, quality and safety, we will commence a process of 1,500 extra audits of facilities per year under the Aged Care Quality and Safety Commissioner. But we will also put in place, under that commission, regulation to ensure further protection against chemical and physical restraint. We will appoint a new senior restraint leader within the commission and we will extend the pharmacy program within the Commission and under the Department to 2025. In terms of residential aged care services and sustainability, our third pillar, we will, exactly as the Commissioners have recommended, immediately extend the viability supplement, the 30% uplift, to the 30th of June as an interim measure whilst we prepare our response to the budget. But the Prime Minister has indicated that this is an immediate measure today, but there will be a long-term solution set out in the budget. That's the equivalent of $760 per metropolitan resident and $1,145 per rural and remote resident. We will also put in place a targeted fund to support providers facing stress. Fourth, in terms of our fourth pillar, workforce, with regards to skills, we will make available immediately for 18,000 places to supplement those which have already been brought in for new home care and residential care workers to be trained, because if we can lift those numbers, we lift the places that we offer. And that is a critical step forward. And then finally, in terms of governance, we've accepted the Royal Commission's request to respond in full by the 31st of May. We will begin a governance training and funding program for, we expect, 3,700 senior leaders across boards and senior executive. We will put in place a new Aged Care Act, and that will be a significant process, but it's based on a simple concept of respect for the individual. Instead of it being about providers, instead of it being about money, it's about respect for the individual needs. And that is the fundamental generational transformation. And so I'll finish where I started. As a son who's watched this process, as a son who watched his father pass just days before we came into government, I want to thank all of those who have been involved in the Commission, in particular our Commissioners Pagoni, Briggs and of course Commissioner Tracy, who passed during the course of it. But to thank our carers and our nurses, our doctors, our cooks and our cleaners and everybody involved in taking care of our older Australians.